Hi, I'm Dr. Delaney, and let's talk about septoplasty. What exactly is a septoplasty? A septoplasty is a nasal surgery that aims to correct a deviated septum. The septum is a midline structure that divides the nasal passages into two halves. And if you just feel it right here in the front, you can feel that's the front end of your septum. The septum is composed of cartilage in the front and then bone in the back. A deviated septum can form either congenitally from birth with how the septum it develops crooked, or from acquired trauma later on in life. A deviated septum can cause obstruction either on one side or both sides of the nose, and it can also contribute to the appearance of a crooked nose. Now, oftentimes a septum is performed at the same time as a rhinoplasty. The septoplasty surgery is performed under general anesthesia, meaning as a patient, you'll be completely under and you won't feel or remember a thing. The surgery itself is performed through the nostrils, so there are no external incisions and therefore no external scars. Depending on the nature of the septal deviation that needs to be corrected, different techniques may be applied to treat the problematic obstruction. Most commonly, we remove deviated and obstructed portions of the nasal septum. Sometimes we may even relocate where the septum is by shifting it in towards the midline, or actually taking the septum out and rebuilding it on the side table and then reimplanting the septum. Commonly, we also would perform a reduction of the nasal turbinates, which are paired structures on the side of the nasal cavity, if during our examination we notice that those structures also are enlarged and obstructed. After surgery, you can expect to have some soft internal nasal packing inside of each of your nostrils, and these packings are removed the very next day after surgery. It is common to experience some swelling both inside and outside the nose, and you may also experience some nasal congestion, drainage, and tenderness that gradually improves over 2 to 3 weeks. During this time, you may, but you also may not, experience some swelling and tenderness of the upper lip and gum, and this is usually temporary as well. You'll see us quite frequently during the first several weeks after surgery for cleanings and to ensure that you're healing properly. In terms of pain after septoplasty surgery, usually the pain is quite mild. However, we will prescribe you prescription pain medication to be taken on an as-needed basis if you need it for comfort. Sometimes you may experience nausea also from the anesthesia, and therefore some as-needed nausea medication will be prescribed for your comfort as well. Most patients can return to work about a week after septoplasty surgery. Because the nose itself is quite vascular, I ask that our patients abstain from strenuous physical activity for 4 weeks after surgery. If doing well, sometimes I could clear them to resume light cardio, such as using a stationary bike or an elliptical, as early as 2 weeks after surgery. So who makes a good candidate for this type of surgery? For me, there are 2 major considerations. Firstly, we need to make sure that the individual either does not have nasal allergies, or if they do, that the nasal allergies are well controlled using medications. Secondly, we must also consider the nature of the septal deviation. Not all septal deviations are created equal, and therefore not all of them can be treated with a septoplasty. A septoplasty is a very useful tool and can handle most cases of septal deviation. However, the surgery does have its limitations. If the septal deviation is very severe, very anterior, or if there are coexisting external nasal deformities, then a septoplasty surgery alone may be insufficient to bring about the changes in either breathing or appearance that we're looking for. In such cases, a combined case in which both a septoplasty and a rhinoplasty is performed may be necessary to bring about the changes that we're looking for. I hope with this video you now have a much better understanding of what a septoplasty surgery is. I hope you also understand some of the limitations of the surgery, so what the septoplasty surgery can and cannot do. If you're considering nasal surgery, it is important to have a consultation with a board-certified facial plastic surgeon who has a thorough understanding of nasal anatomy and physiology in order to obtain a comprehensive exam of your nose and your nasal passages, and in order to determine what treatment plan would be best suited to your individual needs.